Welcome to This Week in Health IT News, where we look at as many stories as we can in 20 minutes or less that will impact health IT. I am broadcasting on a weekend. I am outdoors on a deck, and you're going to hear lots of animals in the background. So hopefully you'll enjoy the outdoors as much as I do doing this show. It's Tuesday News Day, and here's what we have on tap. We have a lot of stories. Kaiser named their first chief digital officer. Cerner is collaborating with Amazon. CMS has made some moves. Microsoft and others have come together to talk about their desire to share data. We have about 10, 11 stories here. Let's see how many we get to. My name is Bill Russell, recovering healthcare CIO and creator of This Week in Health IT, a set of podcasts and videos dedicated to developing the next generation of health IT leaders. This podcast is sponsored by Health Lyrics. Professional athletes have coaches for every aspect of their life to improve performance. Makes sense, yet many CIOs and health executives choose to go it alone. Technology has taken center stage for healthcare. Get an executive coach. Contact healthlyrics.com. Go to healthlyrics.com to schedule your free consultation. Want to support the fastest growing podcast in the health IT space? Here are 5 easy ways you can support the show. Number 1, share it with a peer. Number 2, follow our social accounts, LinkedIn, YouTube, Twitter. Interact and repost our social media content. Send me feedback at bill@thisweekinhealthit.com. And subscribe to our newsletter and other services on the website. So let's get to the news. Kaiser Permanente names first chief digital officer. This is from Healthcare IT News. Pratt Vimena comes from the consumer world, currently serving as chief product and experience officer at the Home Depot and has worked at Staples, I assume in an executive role. Kaiser Permanente has created a new organizational role aimed at driving innovation in the enterprise digital enterprise digital strategy. It will be filled by Pratt, and he will be tasked to work across all of Kaiser. Let's see. As a Chief Digital Officer, Kaiser Foundation Health Plan and Hospitals, Vimena reports to Dick Daniels, the CIO, and has accountability to Bernard Tyson, the CEO. His job will be to lead cross-functional teams across Kaiser, working to develop new technologies and processes for Kaiser's workforce and transform the way its 12 million members, patients, and customers experience its online, mobile, and digital tools. Vimena, who will begin on August 12th, currently serves as the Chief Product and Experience Officer for the Home Depot, where he charts strategy for improved customer experience across the corporation. He previously held leadership roles at Staples and Informed Clinical Sciences Corporation. So what? You know what? The trend continues. Healthcare is going outside to capture this experience, and experience is the right word, to capture people who understand creating experiences around a product or around a service. And healthcare needs this. Healthcare is doing this over and over again, going outside, bringing these people in. We have many examples from Disney, from Amazon, and now from the Home Depot and others. This is a good trend. This is exciting. I hope we continue to get really good around that consumer experience and get better at it. So congratulations to Pratt, and best of luck in this exciting new role. Next story, CMS takes bold action to implement key elements of President Trump's executive order to empower patients with price transparency and increase competition to lower costs for Medicare beneficiaries. Let's just jump to what they've done here. So CMS, by the year 2020, has requested these changes. Make public their standard charges, defined as 2 types of charges, gross charges and payer-specific negotiated charges for all items and services provided by the hospital. Second item, make public standard charges on the internet in a machine-readable file that includes additional information such as common billing and accounting codes used by the hospital, such as your CPS codes. And a description of the item and service. This provides common framework for comparing standard charges from hospital to hospital. Number 3, make public payer-specific negotiated charges for common shoppable services in a manner that is consumer-friendly. Shoppable is defined as shoppable services are services that can be scheduled by a healthcare consumer in advance. Examples of shoppable services include x-rays, outpatient visits, imaging, lab visits, and bundle services like cesarean delivery, including pre- and post-delivery care. Consumer-friendly is designed as, a means the hospital charge information must be made public in a prominent location online or in written form upon request. Ugh. That's ugly. Let me read that again. That can't be right. Consumer friendly means the hospital charge information must be made public in a prominent location online or in a written form upon request. I hope that it's not either or on that. That is easily accessible without barriers and searchable. It also means the service descriptions are in plain language and shoppable service charges are displayed and grouped with charges for any ancillary service the hospital customarily provides with primarily shoppable services. And let's see, what does Seema Verma say? Well, she said a lot of things. Let's just take this one thing. So all Americans have the right to know the price of their health care up front. Hard to argue with that. It really is hard to argue with that. All Americans have the right to know the price of their health care up front. Let's jump over to Kaiser Health. So Kaiser Health News did a follow-up, did a story on what they did here. And they asked 3 questions. Will consumer use it? Will it save money? And will it become law? Will consumers use it? Experts point to consumer behavior in New Hampshire, which posts price information by insurer online. Only a small percentage took advantage of the online lookup tool, but those who did saved money, according to a recent study by Zach Brown, an assistant professor of economics at the University of Michigan. Still, the new data set proposed by the Trump administration might simply overwhelm many consumers. So will consumers use it? They're not using it a lot in New Hampshire. Well, let's talk about that for a second. New Hampshire is a pretty small state, doesn't represent a huge financial uptake for a startup, and so you don't have a lot of tech players going after this to make this information available in a nice readable format so it's not being used by a ton of people. But those people who are using it are saving money, which would tell me that the process works, but the access needs to be improved. And whenever you hear that, you should hear great opportunity for a startup organization. So for our tech startup people in the audience, regulatory changes and people trying to figure out what to do with it. So there's an opportunity with hospitals to try to figure out how to be compliant so you can help them. The second thing is if they make this data set available, there's a huge opportunity for someone to grab all that data and make meaning of it for consumers and help them to navigate in a way that they save money, which clearly it does based on this study. So will it save money? Well, it saved money in New Hampshire. It will probably save money across the country. And if you improve access, it'll save a lot of money. Will it become law? The Kaiser Health, by the way, answers this question with, will it save money? Maybe not, from experts. Will the consumers use it? Maybe not. And will it become law? Maybe not. So it's a very definitive article from Kaiser Health News on, and they're trying to straddle it here. I'm not trying to straddle it. This is, getting data out into the hands of the users is a good thing. And the question is, how do you get it into their hands in a way that they can use it to reduce the cost of healthcare? If that's your goal, this can be done if that data is made available. We did a project in 2011, as a side note, we did a project in 2011 for a health system, and it had 3 mantras: free the data, share the data, apply the data. But before we go hog wild on those 3 things, because those 3 things have value in healthcare, we really need to talk about one more thing, which is protect the data. And when I think about this, I love what Seema Verma is doing. I love the push of CMS and Secretary Azar and where they're going. But protect the data has to be at the center of this thing, and it's going to be the area that people keep pointing to try to derail it. But here's my twist for you. When I talk about protecting the data, a lot of health systems hear that and they go, yeah, that's right. You need to protect the data. We need to protect the data. I'm saying protect the data from the health systems and the payers and everybody else. As a patient, my data is spewed. What is that a word? Spewed all over the world, and literally all over the world. I mean, it's been hacked. It's been taken from Equifax. It's been taken from health systems. I mean, I've gotten the things that said, "Hey, we've been hacked. Would you like your identity protected?" Yeah, I'd love my identity protected, even though now my health record is all over the world. Okay, with that being said, I want to know. Here are the things I want to know. I want to know, where my health record resides, what parts of my health record reside, where I want the ability to aggregate it. I want to find a player who says, "Hey, I'll aggregate it for you," and I go, "Here's the 10 places it is," and they're able to aggregate it. I want the ability to sell that data. I think that makes sense. I should be able to sell that data. And we talked about that with a guest a couple weeks ago, just that there are places where they recognize the value of health data, and you can swap your health data for value, which is a great thing. So anyway, so protect the data. I think Seema Verma and that team at CMS needs to spend a little bit more time there. I think directionally this is interesting, and I think for our health startup and even our innovation groups within hospitals right now, this is just rich. This is rich for opportunity, and should be looking at it. So let's see. Next story: Cerner collaborates with Amazon Web Services on cloud innovation, machine learning. Let's see. Not going to share much with this. Let's see. With a new agreement which names AWS as its preferred cloud provider, Cerner CEO Brent Schaefer says the company will be able to develop more agile and scalable tools for its clients. Cerner has announced a collaboration with giant Amazon Web Services with the aim of accelerating healthcare innovation as part of the agreement. Cerner is naming AWS as its preferred cloud provider. That's probably really enough on this story. So what? You know, from a Cerner perspective, this is a pre-announcement. We have no idea what they're going to do within AWS. It's just directionally they've named AWS as their preferred cloud provider. This is interesting in that Cerner has been a hosting provider for a long time for its clients, and you know, have they been good at it? Have they not been good at it? It's really up for debate. But the reality is AWS is better at it. They have more services and more things that they can provide within their cloud environment. So the question becomes, what parts of AWS is Cerner going to tap into, and what will it mean for their clients? It's really too early to say at this point. This is, again, great directionally, but from Amazon's perspective, major win, huge win. Depending on what Cerner decides to do on the platform, this really could be a really huge win. You're just going to have to stay tuned to see which direction this goes. Let's stay with these guys. So Microsoft, Amazon, and other tech giants forge ahead on healthcare data sharing pledge. This is a GeekWire article. Amazon, Google, IBM, Microsoft, Oracle, and Salesforce, if you're wondering. They signed a joint letter. Think about that. They signed a joint letter, and here's essentially what the tech giants have much to gain from opening up healthcare data. As proof of this, the joint statement was preceded by news that it's the Cerner news about AWS. Microsoft has been competing fiercely to convince developers in the healthcare industry to build on its platform. The company built on Azure API for FHIR, which is a set of standards that codify how healthcare data should be structured. Last month, Microsoft hosted a developers conference focused specifically on FHIR, and others have progressed. Google's launched its beta version of Cloud Healthcare API. Salesforce continues to grow its Health Cloud offering, and Oracle is leveraging FHIR to bring in clinical trials and other stuff. So they, this is the second year in a row, they're saying, hey, we are committed to making value of this data. So the question, the so what on this is Amazon, Google, IBM, Microsoft, Oracle, Salesforce. How often do these companies agree and collaborate? The answer to that is almost zero. So why are they doing it? They need access to the data, and they haven't been able to get it. That's the reason. This data is a gold mine. And so they are sort of coming together saying, let's move this industry along, let's move this data and make it available. The announcement really means almost next to nothing other than they are saying they are committed to the things that the government is committed to, which is getting that data out there, making it available, and then making meaning of that data for the user community. But the only reason Amazon, Google, IBM, Microsoft, Oracle, and Salesforce do anything is to make money. So we'll have to see how they plan to monetize the value of that. But tucked into this story is this little snippet, and I love this little snippet because it goes to what we were talking about. In addition to the pledge, a coalition of big tech companies and healthcare industry names, including Apple, Humana, and the state of Washington, today announced that they would be testing new standards that give patients access to their claims data. The idea is to let people access their past healthcare information on an app of their choice, which they can use to inform the new providers or make decisions related to insurance coverage. And this gets back to what we were talking about earlier. This is a good example of, addressing the problem and the challenge that that exists, and creating value for the consumers. Let's see. I don't know how many more of these stories I'm going to get to. Let's see. Ascension. How Ascension got 100,000 additional visits this year with the help of online scheduling. And, I just highlight that to say online scheduling platforms are very valuable. This week in Health IT, let's talk Health IT. These are very, very valuable. They fill unopened positions. They make it easier for people to schedule and reschedule visits. And obviously, the larger your health system, the more value you're going to get out of a system like that. The next story I was going to take a look at, Kaiser Health News has a story. Jenny Gold, NBC News covered it. First kidney failure, then $540,000 bill for dialysis. I point out that story, and I brought that story in because, this is an election cycle. We're going to see a lot of these stories. Depending on which side you're for, you're going to, drum up these kinds of stories. This story lends itself to Medicare for All. It's, and let's get the costs covered, and look how horrible our health system is that we would generate this kind of bill. And this is horrible, by the way, to have a $540,000 dialysis bill. The story's worth taking a look at. Definitely something this health system needs to address and get in line on. So NBC News, Jenny Gold, Kaiser Health News also. CVS Health launches social determinants provider network. I think, again, also this is interesting. The reason I brought this in is I think it's interesting to have a platform where you can pull all this data into. I also think it's interesting that CVS is the one that's providing this platform. I think it's called Unite Us? I think it's called Unite Us. And it's about a new platform as part of the company's $100 million effort for building healthier communities, which is funded by CVS as well as CVS Health and Aetna Foundations. Out of about 6,000 waking hours in a year, most people only spend a handful in a doctor's office or hospital, says Karen Lynch, Executive Vice President, CVS Health, President of Aetna, yet spend a vast majority of their time in their community. So it's collecting the social determinants data, putting it all in a place which hopefully then care providers can access it and use it to inform their patients on their different options. So CVS Health launches social determinants provider network. Bruce Japson, Forbes article worth taking a look at. Diagnostic pill samples bacteria while traveling inside the gut. This is Tufts University MedGadget story or study. I don't remember which it is. The reason I pulled this up is I think we're going to have more and more ways that we're going to be collecting data as a health IT organization, and we're going to need to find ways to collect that data, to move that data into the workflow and make it available to the clinicians. This is just another example of, I guess technically this is IoT, a pill as an IoT device, going in, taking samples and reporting back. Very interesting. Let's take a look at this. I mean, we've talked about Amazon a bunch, but this one's interesting. SureScripts ups its battle with Amazon PillPack. We're turning the matter over to the FBI. Amazon-owned PillPack found a way to access its patients' prescription information via a third party called ReMyHealth. SureScripts, which contracts with ReMy, said this represents an unauthorized access to its network. SureScripts is the largest e-prescribing company in the United States. Amazon threatened to sue SureScripts. In turn, SureScripts claimed fraud and sued it in return. This is Christina Farr, CNBC news story. And, SureScripts has all that data, and they're saying that's our data and our proprietary data. And ReMy, which has paid for access, is somehow sharing it to Amazon, which I'm sure violates their contract in some way, shape, or form. And now Amazon is, they're going to be fighting over that data. Who loses in this? Patients. Patients lose in this. That's always the case. Because I think we should be able to secure it. I don't think SureScripts should have control of my script data. I don't think Amazon should have control of my script data. I think I should have control of my script data, and both of them should tell me what value they add to me. SureScripts could say, hey, I make your data available to all the physicians across the country, and I go, hey, that has value. I'll give my data to SureScripts. And Amazon might say, hey, I add value by fill in the blank, and I say that adds value. But I really believe that the consumer should control that. I'm looking to Secretary Azar and Administrator Verma to move that forward. And I don't know, I hit about 7 or 8 of the stories. I wanted to hit more. I hope that brings you up to date on some of the things that are happening in the industry and gives you an idea of where they might go. So that's all for this week. Every Friday, check out our interviews with industry influencers. Keep the comments coming. Bill at thisweekinhealthit.com. Good, bad, or indifferent, it's all very helpful. This show is a production of This Week in Health IT. For more great content, you can check out our website at thisweekhealth.com or the YouTube channel at thisweekhealth.com and click on the video link. Thanks for listening. That's all for now.